But thank you very much for taking part in this brief interview. And Dr. Tana Carson from Florida International University. And I believe that you are going to present in International Hyperacusis and Misophonia Conference in July. And tell us a little bit about the presentation and the research that you have done that led to the results that you're going to present for us.
So first, I want to thank you for the work that you've done over the past 10 years to create such a wonderful conference. It's an amazing opportunity for me to be a part of it and to share the work that we've been doing at FIU. And I'm really excited because all of the people that I've been reading their papers, I see their faces now as speakers and I'll be able to attend their talks. So this is exciting. So at FIU, we are really excited about improving the ability for allied health professionals such as ourselves. So I'm working with Angela Medina in speech therapy and Yushi Q in psychology, and I'm in occupational therapy. And we see hyperacusis and misophonia as a really important problem affecting children, especially children with autism. We know that the prevalence rates are high, but we still have a lot to learn about to what extent it's hyperacusis, it's misophonia, or both. And we're excited about developing a screening tool for allied health professionals to use to help families in identifying these problems and also to help guide treatment. So we've worked together to talk with experts and to talk with families who have children with diagnoses of misophonia, hyperacusis. And our perspective is that we've taken some well-validated questionnaires that are used in adult populations and used those kind of as a starting point to start this conversation. These questions have been validated for adults, so how can we look at these questions and maybe break them down, revise them to build a pediatric parent report questionnaire? And so we've done the first phase of that work, talking with the experts. So we've talked with a lot of audiologists and some psychologists and talking with parents. And so we were able to come up with a questionnaire that includes a certain number of hyperacusis focused questions and misophonia focused questions. And now we're beginning the second stage, which is field testing that questionnaire. So that's where we're at. And that's what I hope to share is that process and what we've learned along the way.
It's fantastic. It's fantastic to see a doctor of occupational therapy actually get involved in developing tools for assessment of hyperacusis and misophonia, because the population that you see in children with autistic spectrum disorder, learning difficulties, so on and so forth, it's, it has to be really the occupational therapy input and leadership in helping these children, and which is much, much harder and for other professionals to actually being able to help them. So it really makes sense for you to be actively involved in assessment and management of children with hyperacusis and misophonia. I myself look forward to learn from your approach as well as your tools and start using them in the clinics as well. And so thank you very much.
Thank you. I have to mention one more person that's been instrumental in these projects, and that's Dr. Cindy Simon. She's an audiologist in Miami that has been really helpful, connecting us to the audiology community. She's the one who brought me to you and recommended the conference. And then it just really opened up our world with this research. So I have to mention her as well.
Lovely, thank you. And so your presentation at the moment is scheduled for 2nd of July at Birkbeck College, University of London. And I hope that we can hear more from your management of children with hyperacusis and misophonia from an occupational therapist perspective as well during the conference. And thank you very much.
Thank you.